Hello students, today we will start with the assessment and the treatment of eating disorder. And under this assessment and the treatment for the eating disorder, full physical examination and appropriate medical investigation is required for proper treatment. Assess patient height and weight. So here the physical examination of the patient or those who affected with the eating disorder, their physical examination has to be performed along with the appropriate medical investigation. Okay, to provide a proper treatment to the patient, this physical examination is must. Okay, physical examination and some of the medical investigation. Then we have to assess the height and weight of the patient. Okay, if any of the following features are present in patient, then treatment is indicated. Okay, so the condition in which treatment can be indicated are the following conditions. If the weight is less than 70% from the normal expected weight, or if the BMI is less than 15. Next, rapid weight loss and the quick weight loss. Okay, acute is nothing but it is a rapid or quick weight loss. And marked dehydration means dehydration which sees clearly, which can identify clearly electrolyte imbalance, convulsions, uncontrolled vomiting, gastrointestinal bleeding. GIT bleeding means gastrointestinal bleeding, and acute inflammation of the pancreas, that is acute pancreatitis, self-injurious behavior like putting finger into the mouth to induce vomiting and all, and also severe depression and increased risk of suicide, intolerable family situation like quarreling among the family members, stress, anxiety, etc. So if all these conditions are present, then we can indicate for the treatment. And here the treatment, under the treatment varies according to type and severity of eating disorder, and usually more than one treatment option is utilized. Okay, so here treatment is different based on the types and severity of the eating disorder, and here more than one treatment option can be used in treatment of patient with eating disorder. Okay, there is no specific treatment for this eating disorder. That means more than one treatment we can use for the treatment of the patient. The first one is nutritional intervention. The goal of nutritional intervention is to normalize the relationship with food, to gain an understanding of nutrient needs for growth development, tissue maintenance, weight control, appropriate body weight. So here under the nutritional intervention, some goals we have fixed. Okay, and the goal for these nutritional interventions are to bring the relationship with food in a normal level. Okay, to normalize the relationship with food means to bring the relationship of the individual with the food in a normal level. Okay, and to gain the knowledge regarding the nutrients or the nutrition which is needed for our growth and development, and also for the maintenance of our body tissues, and for control of the weight, and to have the body weight appropriate to the age and the height. Okay, this and all knowledge, the understanding about all these factors and all these things, the patient has to get an idea on it. Next, to provide and increase adequate energy intake, and to be enabled to give or provide adequate energy to the patient, and increase intake of these macronutrients means to provide or to promote the weight gain. First, 800 to 1200 kilocalorie per day. Then this much amount will provide to them in the first starting day, and it has to be increased gradually to avoid to achieve the goal of the weight gain, that is 0.5 to 1 kg per week, that is in 1 week 0.5 to 1 kg, or the stabilization of the weight in case of the obese patient. Okay, in case of the fatty patient, the stabilization of the weight is needed for them. And in the fourth goal, introduction of fair food, adequate vitamin and mineral, and promote energy expenditure in binge eating disorder, that is BED. So here in the fourth goal, introducing or encouraging to have the food which they build up a strong perception, especially in patient with this orthorexia nervosa. Means in this condition they avoid food which they believe harmful, right? So here in this case we have to encourage the client, or we have to encourage the patient to have different kind of nutrition requirement for their body. Okay. And next is to increase the adequate amount of this vitamin and mineral intake, example like calcium, magnesium, potassium, zinc, iron, vitamin B, etc. And to promote the use of this energy or the energy expenditure in the patient with binge eating disorder, as they consume a large quantity of food, right? Binge eating disorder patient, they will consume large quantity of food. That's why it is very much important to promote the use of this energy or the energy expenditure, the forms of energy expenditures. Next is formulation of nutritional plan. The nutritional plans will be formulated or will be done based on these requirements like energy, protein, vitamins, minerals, zinc, and others multivitamin and multimineral. Okay. Here, energy must observe energy intake with regard to weight gain. Must be aware that refeeding in anorexia nervosa increases. Be aware of individual responses. May be a period of abnormal energy requirement for weight gain and maintenance. And restrictors have greater energy requirement than bulimia nervosa and the binge eating disorder. So here in this, energy intake must observe with considered or with respect to the weight gain. Okay, and we should consider about energy intake and the weight gain here, and also we should be aware or concentrate about the refeeding in case of this anorexia nervosa patient. Okay, so if anorexia nervosa patient we are taking care for them, means we should always aware or remember about the refeeding of the patient. And also when the symptoms of anorexia nervosa exist, we should aware about the refeeding. Okay, and should not focus on the individual response during the maintenance of their weight and energy requirements. And the restrictor have great energy requirement. This means that the restrictor means those who have anorexia nervosa, orthorexia, they need more energy than people those who are having this bulimia nervosa and the binge eating disorder. So this is all about energy requirement. Okay, that means we should consider about energy intake and their body weight or the weight gain, and should be aware about refeeding to the anorexia nervosa patient. And also we should focus on the responses of the individual during maintenance of the height and energy requirements. And also energy is much needed for the patient, those who have anorexia nervosa and orthorexia. Then regarding the protein, 1.2 to 1.5 kg per kg IBW, that is ideal body weight. So needed protein is 1.2 to 1.5 gram per kg ideal body weight. And next is vitamins, requirements of vitamins. And the vitamins required for the treatment are D, B complex, vitamin D, vitamin E, vitamin A, and B carotene. Okay. Next, dose of the minerals are calcium, zinc, and iron. And zinc supplementation has been shown in various studies to be beneficial in the treatment of anorexia nervosa, even in patients not suffering from zinc deficiency, by helping to increase weight gain. Ideally use low doses multivitamin and multimineral. So here zinc supplement is found to be beneficial in the treatment of this anorexia nervosa. Means zinc treatment, it is important or it is beneficial for the treatment of anorexia nervosa patient, and the zinc supplement can give the patient those who are suffering from this zinc deficiency, and also for the treatment of this anorexia nervosa, as zinc help to increase the body weight gain. Okay. And next one, the low dose of multivitamins and multiminerals are needed. Multivitamins and multiminerals are needed in low doses only, okay, for the treatment of this eating disorder. And the next one is cognitive behavior therapy. So CBT, or the cognitive behavioral therapy, which postulate an individual's feelings and behavior are caused by their own thoughts instead of external stimuli such as the other person, situation, or events. That idea is to change how a person thinks and reacts to a situation, even if the situation itself doesn't change. So here cognitive behavioral therapy, this type of psychotherapy also we have to prefer to the patient, those who are having eating disorder. Okay, so why cognitive behavior therapy? So there in the definitions we have seen that eating disorder is the severe disturbance in eating behavior of the individual, right? So it's one of the mental illness, and it will bring a severe disturbance in the eating behavior and their lifestyle of the individual. So individual feelings and behavior, these are caused or maintained by their thoughts instead, not mostly from the external stimuli, that is by other people's stimulus or the events. Okay, so the individual feelings and their behavior, these are causes or maintained by their own thoughts only. In CBT, this cognitive behavioral therapy will allow the individual to give an idea to change how a person thinks and reacts to a situation. Even if the situation is unchangeable, the situation itself doesn't change. Okay, so even if the situation is unchangeable, even though that time the person, their thinking capacity, their thinking level, this can change, right? So CBT will allow the individual to give an idea to change how a person thinks and react to a situation, and teach the patient to recognize the cognition around eating and to confront the maladaptive cognitions, introduce forbidden foods and regular diet, and help him or her confront irrational cognitions about this. So here this therapy will teach the patient, CBT therapy teach the patient to find out those thinking or believing about eating behavior and the eating pattern. Okay, so this therapy will teach the patient to find out any abnormalities or any normal thinking and believing about their eating behavior and the eating pattern. And it also changes the maladaptive cognitions or beliefs of the patient. Okay. Next, introduce or provide forbidden diet. That means diet which the patient doesn't accept. Okay. So with the CBT, with the help of CBT, they can change their mind, they will find the solution, and through this we can introduce the forbidden diet that have to introduce to the patient with clear clarification about their misperception. Okay, we have to explain it clearly, we have to clarify the doubt, and after that we can introduce or we can provide their forbidden diets. Eating disorder are unhealthy diet practice that can easily get in off hand and are difficult habit to break down. Eating disorder are serious clinical problem that require professional treatment by doctor, therapists, and the nutritionist. Okay, and eating disorder, these are the unhealthy practices. Okay, eating disorder like anorexia nervosa, bulimia nervosa, these all are the unhealthy practices. Okay, and that can easily get in off hand and difficult habits to break. And sometimes if we adjusted to these disturbances in eating pattern, then it will become our habit. Okay, so sometimes it is difficult for us to break this disturbance in our eating behavior. Next, eating disorder, these are the serious clinical problems. Okay, so these eating disorder are the serious clinical problem, and for this problem we require professional treatments by doctors, then by the therapists, and also by the nutritionists. So with this, our the portion or the topic eating disorder has got over, and if you have any doubt on it, you please try to clarify it.